According to the American Academy of Neurology, about 15% of patients that are diagnosed with a migraine also have a disorder called the Alice in Wonderland syndrome. This topic should be important to you because it is something that occurs in many children and young adults, and it is a very hard syndrome to diagnose. This syndrome also closely relates to body dysmorphia, which is a serious problem that happens in many people nowadays. The AIWS, the Alice in Wonderland syndrome, is a rare neurological disorder that affects one's perceptions of themselves and their surroundings. To illustrate this, we are going to define the Alice in Wonderland syndrome and look at how it affects the brain, along with some specific cases of it. To begin with, we are going to define the Alice in Wonderland syndrome and look at the symptoms of it. This is a neuropsychological condition that can cause one's perception to be distorted. The distortion can be seen through their surroundings, their body image, and time. These are temporary episodes that occur, and they only last about a few minutes or up to an hour. These episodes are very much like hallucination, but are not quite it. For medical news today, the most well-known symptom of the Alice in Wonderland syndrome is a migraine. Other common symptoms that occur are fevers and epileptic seizures that only happen in a portion of the brain. Other things that accompany this disorder is common symptoms of nausea, dizziness, and agitation. The most noticeable thing of the disorder is when someone knows their perception and their body image is off. Most of the time, someone that has this disorder suffers from micropsia, which is when objects appear smaller than they actually are, or macropsia, when objects appear larger than they actually are. This syndrome gets its name from the story of Alice in Wonderland, where characters would hallucinate and not see things as they truly are or their size. Now, we are going to look at how the brain is affected and the causes of this syndrome. Although there is not much difference between a brain with or without this syndrome, an MRI done by Dr. Sheena Arora, a Stanford doctor, showed that during an episode of AIWS, there is an abnormal blood flow to some portions of the brain, the ones that mostly control vision and perception. Scientists think AIWS can occur due to a change in the brain, most likely happening in the parietal lobe. The parietal lobe is where it helps with your surroundings in the perception of it, which makes sense why this is affected during an AIWS episode. A lot of people who suffer from this disease lose their sense of perception of themselves, which causes body dysmorphia, which this could lead to other mental illnesses if it's not fixed. There are many underlying causes of AIWS. From Neurology Live, it states the most reported cases of Alice in Wonderland syndrome come from people with migraines, epilepsy, and/or head trauma. Many other common causes include brain tumors, certain medications that are mostly cold medicines, and the influenza A virus. Following this, we are going to discuss specific cases of the Alice in Wonderland syndrome. In a New York Times blog, Helene Stupinski describes her instances that her and her daughter had when they had AIWS. For multiple nights, her young daughter would complain about bad headaches before she went to sleep. One night, her daughter said that everything in the room was super small, abnormally small, and she admitted to her mother that this wasn't the first time that happened. Stupinski then followed this with that this happened to her when she was a young child too, but only when she would have fevers. They both described this as they were looking in through a dollhouse, or Stupinski also said that it felt like she was looking through a telescope at times. This is the picture that Stupinski put in the article to show that everything felt like they would feel crammed in spaces because of it. This disease is thought to be genetic, possibly, because Stupinski had 2 kids and they both end up having AIWS episodes, along with her mother, who most likely she received it from, also had AIWS. Some of the family's cases were minor, but while others had episodes that they could not even walk, talk, or stand during. Again, the Alice in Wonderland syndrome is a rare neurological disorder that affects one's perception of themselves and their surroundings. We looked at what the syndrome does and how it affects the brain, along with some specific cases of it. Although it is a rare condition, the Alice in Wonderland syndrome is something to be aware of because it affects more people than scientists first thought and is only becoming more diagnosed syndrome. Thank you.